This is The Fan, WFAN.
The headline reads from the press release from Little League Baseball. A baseball pitching study shows overuse is primary cause of arm injuries, and the subtitle is No Proof That Curveballs Are More Dangerous Than Any Other Pitches. And we're talking this morning about this extraordinary announcement from Little League Baseball that if you have a youngster who likes to throw curveballs or sliders or experiment with other kind of pitches that put tremendous pressure on their arms and elbows, as far as Little League Baseball is concerned, that's fine because they're not going to suffer any injuries long-term in terms of their baseball career. I'm talking this morning with Dr. Timothy Kremchek, one of the country's leading orthopedic surgeons, medical director, chief orthopedic surgeon for the Cincinnati Reds, and we're taking your phone calls at 1-877-337-6666. Dr. Kremchek, I have to tell you, if I'm a mom or dad and I have a kid who's a promising pitcher, and I see this announcement by Little League Baseball, talking this morning about this extraordinary announcement from Little League Baseball that if you have a youngster who likes to throw curveballs or sliders or experiment with other kind of pitches that put tremendous pressure on their arms and elbows, as far as Little League Baseball is concerned, that's fine because they're not going to suffer any injuries long-term in terms of their baseball career. I'm talking this morning with Dr. Timothy Kremchek, one of the country's leading orthopedic surgeons, medical director, chief orthopedic surgeon for the Cincinnati Reds, and we're taking your phone calls at 1-877-337-6666. Dr. Kremchek, I have to tell you, if I'm a mom or dad and I have a kid who's a promising pitcher, and I see this announcement by Little League Baseball, you know, this basically is giving me the green light to tell my youngster, sure, you might as well go out and throw as many curveballs as you want. You can experiment with sliders. You can do anything you want because apparently Little League Baseball, which says if you go to its website, all they care about is safety first. That's their mission statement. Safety, safety, safety. And here they're saying that no, not at all. Curveballs do not pose any danger whatsoever. Now, obviously, in the first segment of the show here, you've said that's not. You can't believe this. This is extraordinary. This is, to me, and I understand their position about the fact that they feel the real concern is overuse, and we'll get to that in a second, but. This is going to have, in your practice, you're going to see even more kids in the next 3 or 4 years coming to you with arm injuries, don't you think?
You know, I hope not, because I've seen the number go down as we've taken this crusade of, number one, pitch counts and the types of pitches that our kids throw. But you're right, it opens up a can of worms, and it's taken a very, very prestigious organization like Little League Baseball, and I think they're being irresponsible. That'd be like somebody writing an article saying that smoking doesn't cause cancer, and all the tobacco companies and saying, hey, kids, you can smoke. Well, now, we have overwhelming evidence that shows that it does, but you're taking an article and you're running with it. And again, that would be irresponsible. I mean, I see baseball players all day. I see little leaguers all the time with arm injuries. I've seen kids that, I've done 9, 10, 11-year-old Tommy Johns, kids that have flown from all over the country. I've also done a lot of youngsters that are 15, 16, 17, 18 years old that were abused by throwing too many breaking balls. And it's not necessarily throwing breaking balls. And now if you threw a breaking ball the correct way every single time, biomechanically you could probably prove that it doesn't aggravate your arm that much. But the truth of the matter is even the big leaguers don't throw breaking balls correctly all the time. And little guys that are 10, 11, 12, 13 years old can't grip the ball right. They grip it too hard. They throw it, try to spin it too much. The mechanics aren't right. And so it's a very, very dangerous pitch for those reasons. So all in a very safe, controlled atmosphere, sure, spinning a ball might not aggravate your elbow or your shoulder that much. But in game situations where kids try to throw the ball too hard and spin it too much, which is going to happen most of the time, it's a very dangerous pitch, and it's a very dangerous pitch when you do it over and over and you don't throw it the correct way. And studies have shown that. And studies have shown that the amount of shoulder and arm pain, especially in sliders, and that's what kids end up throwing. They don't throw necessarily the curveball where it goes down. They throw sliders, the breaking ball where it wants to cut to the side. and you have to drop your arm a little bit, that places tremendous torque on the elbow. So I don't care what the University of North Carolina says. Those of us that see it, even Jim Andrews, who's laboratory, has done laboratory tests, and they've come out and said, we can't prove curveballs cause elbow injuries. It comes out and says, I wouldn't necessarily hang my hat on that study. That's his own lab, because he sees these kids in the office, too, and he doesn't want to be doing surgery on these youngsters any more than I do.
Well, now, you mentioned, of course, and I should point out that the study was conducted at the University of North Carolina, and they looked about at 1,000 kids in a lab. Dr. Glenn Fleissig is the one who works for Dr. Andrews, and Dr. Fleissig is the one over the years have been trying to conduct these studies. But it's curious you mentioned Dr. Jim Andrews because, as you said, he sees thousands of young patients as well with arm injuries. And over the years, he has been one of the physicians, one of the surgeons who has published a couple of major papers not too long ago about basically warning parents and coaches about kids throwing curveballs at a young age. So it's kind of curious to see exactly this sort of about face by Dr. Andrews. He's not really quoted in the press release, although obviously there's attribution to him and his clinic. So something, and again, the side issue here that they're trying to cloak this around is the fact that there's overuse. That it's not, it's not the curveballs that kids throw, it's the fact that kids basically throw too much. We know Little League Baseball, again, you mentioned the politics involved. It's my theory, my opinion, that in the last 10 years or so, Little League Baseball has seen a lot of its top players drift away from Little League competition into other travel programs, AAU Baseball, Cal Ripken, whatever. And because Little League Baseball is losing these kids, they're saying, in effect, well, if you stay with Little League Baseball, we can control the pitch counts in the games, but if you're throwing for other leagues during the week, we have no control over that, and that's where your kid's going to start running a risk by being used too much. And they say, by the way, curveballs aren't the real issue here. It's just the overuse stuff. I'm curious, what's your reaction to that, Dr. Kremchek? I'm also curious, have you had a chance to get any reaction from any of your colleagues about this study?
Actually, number one, I think a couple years ago, I was very vocal. We had our Hamilton team went to Hamilton is close to Cincinnati, Ohio, about 25, 30 minutes away outside of Cincinnati, went to the Little League World Series. And we've had a couple of the youngsters that have played in that league have injured their elbows a couple years, and their high school careers have basically been shot because of it. They're star pitchers. And so I have found out very quickly how political the Little League Baseball Society is. I really had absolutely no idea, and I was shocked at the lobbying that the Little League Baseball has, the power that they have from the stances that they take. To me, a lot of this is driving this, and that's what makes this so difficult for me, because you try to teach these traveling teams, the coaches, the leagues, that it's all about the kids and not about you winning. It's about developing them as baseball players and young men. That's what this is all about, not by winning necessarily at all costs. And I think once this crusade, newspaper articles are written, the radio shows are done, now we're getting the parents are becoming advocates of what we're doing to protect our kids, not necessarily trusting the coaches, because the coaches have ulterior motives.
Well, the coaches want to win. There's no question about that.
They've got sponsors. They've got to pay for equipment. They've got all sorts of things they need to do. But we've got the parents on our side. Now, the danger with this is that all of a sudden the parent who wants their son to continue to grow and to get a college scholarship or get drafted sees that he's got to play on these teams, so he's teaching Johnny in the backyard how to throw these breaking balls because Little League says it's okay. That's the danger here. Because once that youngster hurts his arm and needs an operation, the chances of him really excelling and going to that next level and a level above really diminishes. So I think, I am, for those out there who don't understand, Little League Baseball is a very political organization. And I think everybody's been very careful when they walk on eggs when they're talking about Little League Baseball, get involved with them. And I think they've taken an irresponsible step here. And I think they need to take a step back and really make people understand and say, look, we can't necessarily prove that it does. and we don't recommend that our youngsters do throw these kind of pitches. I think that would be a retracted step that would go a long way. I don't think they'll do it. There's too much riding on the ESPN World Series on TV and watching these kids throw breaking ball after breaking ball, trying to compete with these other countries.
Let's go to some of our callers at 1-877-337-6666. Let's start with Vince in Rochelle Park, New Jersey. Vince, you're on the fan with Dr. Timothy Kremchek and Rick Wolf. Good morning.
Hey, how are you guys? I appreciate the message that you're giving out there. I'm a performance trainer. I also have my doctorate in orthopedics and sports medicine in physical therapy. And over the last 15 years or so, I've unfortunately treated, and have seen kids 13 and 14 retire. And I have 6 kids right now in my office that are in high school, under high school age juniors, that have 6 Tommy John procedures. And the thing that I've been seeing, of course, sliders, curveballs, and it is a bad mechanical thing for a growing athlete. But the other thing is the volume that I see. When I sit down with a mom and dad and the kid's elbow and shoulder's hanging, I really have to dissect, well, how's it hanging? So the kid's on a travel team, he's on a club team, and then also he has a pitching coach. And altogether, none of those 3 different venues ever add up the pitches that this kid is throwing. So at the end of the week, the kid could be throwing 200 and 300 and 400 pitches. They never even think that the pitches in between the game count. They never even count the pitches before the game. And you know what? The big thing that I find with these young kids, if they're the pitcher in the game, when they're playing wiffle ball in the backyard, who's the pitcher? It's the guy. It's the little boy that's on the mound all the time. So now he's pitching a wiffle ball, pinky ball, a hard ball, and then he has a skill coach. The other thing that I find is that these kids, proper warm-up, proper flexibility. They walk to the field with their flip-flops on. Their mom's carrying their bag. Everyone's complaining about the long schedule, and nobody's properly warming up. No one's doing proper strength and conditioning. I find that these kids want to be treated like pro athletes, and it's a joke because they're not pro athletes, and they need to be boys.
Let me stop you there because we're up against the clock. But I hear you on this point. I hear you loud and clear. And it's funny you mentioned about pro athletes. Well, any professional athlete, that preparation is key to obviously making sure that they're at the top of the game and preventing injuries. Obviously, they in terms of stretching and going through the routine every time before they pitch. But Dr. Kremchek, Vince's point about the fact that these kids are just going out there all the time, day after day in various leagues, and obviously that's a part of this because we all agree that if kids go out and throw 80, 90 pitches every day, especially if they're throwing curveballs, that is going to have an effect in terms of the health of their arm and shoulder.
There's no question about it, and that's one of the things we've run into in Major League Baseball, how long these guys play, how long the season is, what they do in spring training. We watch their pitch counts. All of our pitchers are starting our relievers from the beginning of spring training to the end so we can avoid injuries. And we do know that the little leaguers that throw for over 8 months and are out of the year have a 5 times greater chance of having surgery on their arm. So, and the preparation is absolutely right. The major leaguers get there 2 o'clock in the afternoon for a 7 o'clock game. Preparation, stretching, strengthening, strength conditioning. These little guys, first of all, they're not physically strong enough. They haven't matured yet. Their muscles are not completely formed because of the maturity. And you're absolutely right. They're out there playing sometimes 4 or 5 games a day. They're playing 6 or 7 days a week. And then throw on top of that the torque of a breaking ball, curve balls, trying to win, radar guns behind home plate. It is unbelievable the stress that these youngsters mentally that they go under to win.
Yep.
You've opened up a can of worms, and the curve balls and the breaking balls are just part of it. But again, we're trying to say that's okay. Let those kids go out and do whatever they want to do. We're not going to hurt them. Well, they're not sitting in my office seeing 100 people a day and seeing 30 or 40 kids a week with their arms, as you said, hanging down, and the parents going, geez, I don't know what happened.
Dr. Kremchek, if you could you stay with us a little while longer?
Absolutely.
Well, thank you for that. Again, we're talking with Dr. Timothy Kremchek of the Cincinnati Reds, the medical director, talking about this astounding proclamation from Little League Baseball that curveballs do not lead to injured arms with kids. Amazing. 1-877-337-6666. We'll take a timeout. Here's Peter Schwartz. He's got your flash.